Hi everybody, it's Jenny, your CNA instructor from MedEd. So the last procedure I'm going to go over with you is how to apply TED hose. TED stands for thromboembolic deterrent hose. We also call them compression stockings. They help decrease swelling, decrease the risk of blood clots, and they increase circulation. So the first thing you want to do is your initial steps. Ask your nurse about your resident's needs, abilities, and limitations. Knock on the door, request permission before entering. Call the resident by the name they prefer. Identify yourself by name and title. Explain what you're going to do. Find and gather your supplies. So I have my compression stockings, my TED hose. I'm going to close the curtain drapes and doors. I'm going to wash my hands, wear gloves as needed for standard precautions, and use good body mechanics. So before you put TED hose on, you want to check the skin for rows. R-O-W-E-S, kind of like row of oat. R is redness, O, open areas, W, warm, E, excessive dryness, and S is for swelling. If you find anything unusual, make sure you report it to your nurse. Now, when I put these TED hose on Annie here, it's going to look kind of easy, but I just want to warn you, these stockings are very, very tight. So if you can just slide them on like a loose pair of socks, that's not the right size. They're not working right. You want to put these on before they get up out of bed. The hole at the tip of the TED hose sits on top of the toes, as I'm going to show you in just a minute. But you don't put the toes through the hole. This is for the nurse to check circulation. So to put on TED hose, you're going to bunch it up into your hands. So just gather it up into your hands. And you're just going to flip it a little inside out at the mid-foot area. And you just slip it over the toes, heel, and up the leg. And they make it sound really easy, but it's not. Slide it over the toes. Bring it up over the heel. So you see how fun I'm having here. You're going to have the same fun when you put them on in clinicals. Right, we're over the heel. Gonna extend it up your leg. You want to smooth away any wrinkled or twisted areas. And I'm gonna kind of bend our leg a little bit here. But you want the whole of the TED hose sitting over the tops of the toes. You would repeat with the other leg. Now, TED hose are a little different as far as how often we check them. Most our procedures is once a shift. This procedure, twice a day. So you want to remove the TED hose at least twice a day, checking the skin for redness, open areas, warmth, excessive dryness, or swelling. Once you're done with the procedure, make sure you do those final steps. A, alignment, make sure they're comfortable. B, make sure the bed is in the lowest position. C, make sure they have their call light and water. D, ask them if there's anything else they need. And E, everybody deserves a thank you. F and G, find and gather your supplies, clean them to company or facility policy. H, open up those hanging curtains to their wishes. Wash your hands, do a visual safety check, report unusual findings to your nurse, and document. Thanks for watching.